This month, CommonWealth Beacon is focusing on healthcare, and this week we're checking in on the workforce. Across the country and here in Massachusetts, healthcare systems are feeling the squeeze from rising costs of care, staffing shortages, hospital consolidations and closures, and what's being referred to, frankly, as a primary care crisis. I'm Jennifer Smith, and this is the Codcast, CommonWealth Beacon's podcast about policy and civic life here in Massachusetts. Today, I'm joined by 1199 SEIU Executive Vice President Cari Medina and Anestine Bentick, Lead Medical Assistant at South Boston Community Health. 1199 SEIU represents over 85,000 frontline caregivers in Massachusetts hospitals, nursing homes, home care, clinics, pharmacy, and all other areas of the healthcare industry, and this is mostly in urban rather than rural areas of the state. So, Cari, Anestine, thank you so much for being here.
Thank you for having us.
Thank you for having us.
Cari, why don't we start with you right now? From the union perspective, what trends in healthcare have caused you some concern over the last few years?
Yes, some of the trends that we've seen are workers being burnt out because of lack of staffing and not being able to care for their patients or provide quality care because they are just so busy. Lots of extended wait times in the emergency rooms. In any department, really. We've also heard a lot of persons not being able to, or our members, I should say, are not able to keep up with cost of living. Their wages are very low, and trying to make ends meet is very difficult. And then the closures of facilities as well as reduction of services for the community and our patients is a trend.
And Anestine, you work at South Boston Community Health. Is what Cari's describing aligning with your experience of your work in that health center specifically?
She's spot on. She is. It's the same thing with patient care, short staffing. We now at South Boston, since during COVID, after COVID, we're doing co-op student because we had such a turnover. And these co-op students are students who is in UMass and different colleges that they come in and they work with us for about 6 months. And then we have another group that comes in and they're great kids, they're learning. But for us as a union, I would prefer to see that we are able to hire our own union staff members that are union. So, but for the time being, that's what we're having and that's what we're working. Our patient our load is up because of the closing of the County Hospital. So we have an influx of patients, which is good for business. But then on the other hand, we know what's about to come down the pipeline.
So, to dive into a few of those areas that you mentioned, we've made reference to closures here in the state, notably because of the Stewart Healthcare bankruptcy. We saw two community health centers close, one in Ayer and also in Dorchester. So, that's the Neshobe Valley Center and the Kearney Hospital. Others survived, but Cari, how quickly did you start to feel the ripple effects from those closures? And what did that actually look like from the workers' perspective?
Quickly. It started already from the pandemic. We know that because of those two hospital closures, not only that, but in the midst of the pandemic, there was a flood at Norwood Hospital, which never reopened. The communities were devastated, lack of care, no access, especially in rural Neshoba. Patients have to now travel even further for care. The community lost a lot of jobs, and they were career-long jobs that folks held. We were able to fairly quickly find them positions in other hospitals that were represented by 1199. But more importantly, it's scary because patients have to seek care so far away. Just even getting prescriptions filled or having a regular doctor's appointment is a struggle.
And those closures happened against the backdrop of the primary care crisis, of course, with high levels of burnout, staffing shortages, all of that. So, are people being attentive to the right pain points where the squeeze on staff creates problems for patients? What's getting lost here?
I think what's getting lost is that employers are probably not feeling that workers are that burnt out. I think that they feel, um, you know, the workers have been doing it. They've been providing care as best as possible. And so maybe focusing more on being a little compassionate for our workers, and ensuring that they are doing well, that they have time off if needed, and not being forced to work overtime or extended shifts when they too have to balance their work and life.
And so, Anestine, I hope you can kind of flesh this out a little bit from your perspective, which is what are the trade-offs? What are the calculations that you and your fellow workers are making on a day-to-day basis when you're trying to figure out how much time you have to spend on any given patient, how stretched the resources are? How are you making those decisions?
I think patient care is the utmost at our forefront at the health center. And so we are not mandated here at the health center for overtime. So that's a different piece than other facility. So we would focus on patient care, make sure they get the best of care. And we have a good group of workers, even though that our our management team, they are well aware of what's happening in the healthcare industry. So we would have providers that jump in and put their patient in for us too. Or if we cannot, or we're doing like point of care, which is different things, and we say, well, we can't do this, said, okay, we'll send them to the lab. So we adjusting. I think it's a little different, and I can't speak for all the other facility. I could only speak on South Boston where I work, and I think they understand and understanding what the situation and the circumstances with everything that's going on in healthcare. So they jump in, roll their sleeve up, and try to help as best as they can.
Cari, one thing I think is probably important to note here is that 1199 SEIU represents a pretty wide array of frontline caregivers, and many are women, people of color, and immigrants. So, how is the workforce itself being impacted by the broader environment right now around how we deal with vulnerable communities? Because some of those vulnerable communities, of course, are also the people providing the care.
Yeah, spot on. We can't talk about healthcare workforce without recognizing the essential role of immigrant workers. They're caregivers. They are essential workers in our hospitals, our nursing homes, our community health centers. They show up every day and are hardest hit. They provide critical care and support patients and families, especially the PCA world, personal care attendants, where they're the persons who go and take care of the disabled, the seniors, and children. So we have to make sure that we're protecting our healthcare system, but that also means protecting people who keep it running regardless of where they were born.
And on immigration, we've seen a number of changes: more forceful immigration enforcement, ongoing attempts to revoke temporary protected status for groups who face dire conditions back in their home countries like Haiti or Venezuela, changes overall to benefits that immigrants can access depending on their citizenship. That's a start. In Massachusetts, as an example, many Haitian immigrants work as home health aides. So, in terms of concrete impact, how have immigration policy changes affected the workers?
Sure. We are already seeing workers in personal care attendants losing their positions because of the work authorizations. We've lost about 185 workers already. We're seeing layoffs. We are seeing business model changes or structure changes in our facilities. There's been about 100 people who've been notified that their status at work is probably going to be terminated at a Boston Medical Center, for example, main campus. So we are seeing the hospitals and health centers, home care, everyone is scrambling to think of a plan and how they're going to address it, because let's face it, we've seen short staffing for years. It's been far too long, and just exasperated now with everything pandemic, and these new executive orders.
Well, the related question is one thing that you mentioned, which is sort of the atmosphere of fear and concern. We're talking as immigration enforcement action has been ramping up in the Boston area and across the state, which, of course, the Trump administration says is a necessary way to retool and address a broken immigration system. Anestine, what is the feeling inside of these health centers?
Horrible. Horrible. As Cari was saying, I had a couple of our coworkers who are Haitian. They were asked to leave because of their status. We were one of the health center that provided care for most of our Haitian patients that they're no longer here because of what is happening, and so I was just speaking to one of my coworkers that just told me that work in the dental department that they were so scared. No one wants to come in to keep their appointments because they heard rumors that ICE was in the neighborhood, which they were, and they would not keep their appointment. And that's really frustrating because we have the most vulnerable patient here in the health center in our community. And it's very sad that they're not going to keep their appointment because they're afraid. We think about our pregnant patient with birth low mortality rate. If you're not going to keep your appointment, then we don't know what's going to happen. They cannot afford. They're calling to say, do I have insurance still? Am I sure that I'm going to get my co-payment pay? And so it's hard. It's terrifying for me as an immigrant. It's horrible. It's really, really, really horrible. Saying it and seeing it and living through it is just terrible.
Cari, what have you been able to try and do? Obviously, there are limits. You're not the government. You can't directly change policy. So, what are the steps that the union is trying to take to mitigate the fear and advocate on the policy front?
The advocacy, obviously, as you mentioned, we're not able to prevent ICE from entering facilities, but what we have done is created a toolkit with resources for folks to be able to have the ability to seek legal guidance. Some of our contracts, we've been able to negotiate that workers have time to be able to get their documents in order. And if they've been able to get their status updated or corrected, that they are able to return back without losing seniority or, their position. And so we're grateful that employers are working with us because they don't want to have to do this, to release workers, but they have to follow the law. So I would say that we will just continue to provide as many resources and materials and tools that we find through our lawyers, and provide them to our workers whenever we can.
Again, when we talk about the current situation, the thing that we have to acknowledge is there was already a pretty serious crunch in terms of healthcare capacity, especially from the worker front, before the Trump administration returned to office. But the state and other organizations have to start planning for looming cuts to Medicaid, which might not be fully felt for a few years. So, how is Massachusetts doing compared to other states, in your view, Cari, as kind of bracing for those impacts and dealing with the issues that are already before us? Because I'm sure the union communicates with unions in other states to see how everyone's doing.
I mean, I think that Massachusetts is trying their best to figure out a way to protect healthcare system. I think that the legislators are listening. We hope that they stand with us. We know that the mayor recently was sent, I guess, orders or a letter stating that she had to comply with the administration's policies or orders. And I think that they're trying their best to do the best that they can to think about our communities and our workers and our patients, and that they will just continue to support as best as possible. And I'm not an expert in that. And I just think that, we'll continue to work together.
And Ernestine, as an immigrant yourself, how has the conversation around immigration status in the healthcare workforce not just struck you directly in kind of your work capacity, but in talking to family members, other people who are in similar positions, either in Massachusetts or elsewhere?
I think in Mass, because I'm from the island of St. Vincent. And so I speak to a lot of my friends who live in New York from St. Vincent. And I think they have it a little worse than us here in Massachusetts because they would rung them up. And I think that as an immigrant, it's appalling. It's terrifying. I've been here since 1987, and when I have to take my citizenship card and put it on my phone and walk around with it just in case, because we can say that it's not going to happen to us, but it can happen to all of us. We may not be the person today, and to see that people are like just being kidnapped off the streets. One of our patients was coming to the health center. This was just last week, and got stopped because ICE was in South Boston and took him for someone else. But thank God it wasn't the person that they're looking. That's just like horrible, horrible, horrible. You cannot imagine being. For me, I'm documented and I feel like this, but not being undocumented. No one should be undocumented anyway, but whatever they're saying, ISIS is saying, to have that feeling. It's a terrible feeling. And our health center here is doing the best. I mean, we have a really great CEO here, Bill Helpin, and he's doing the best to protect the workers and our immigrant family, because we have a population of immigrants, Haitian, Cape Verdean, Albanian. So we have a huge variety of immigrants family here. And he's doing the best to protect our patients and his workers.
And Cari, thinking about preparing for potential Medicaid cuts, how have you been thinking about those?
Well, we know that Massachusetts has the wealth to be able to address these or mitigate these issues. We know that about 350,000 people here in Massachusetts are going to be impacted. Premiums could rise for thousands of our workers and low-income families, rural communities, immigrants, seniors, everyone we just talked about are the persons who are going to bear the brunt. So we want to make sure that Massachusetts uses its tools by tapping into the $8 billion rainy day fund, or we could look at other ways to raise revenue. We can ask these multinational corporations where they shift profits overseas that they should be contributing more. And that's how we think that Massachusetts can protect access to care for everyone, especially those that can't afford to lose it.
To kind of put a point on something that's come up a few times, it's not a strict delineation between the people who are working in healthcare and the people who need to access healthcare. Nurses, practitioners, everyone, they also need to use their own healthcare system. So, Anestine, I'll start with you here. Can you tell me what it's been like for you trying to actually access or avail yourself of healthcare aside from providing it?
For me, it's the premiums are high, but it's okay, because you have to decide, are you going to do your healthcare, are you going to pay your rent, or are you going to do all the other bills? And this is where it comes in, that coming down the pipeline, that our patients are going to have to make decisions with these Medicare cuts. What do I do today? Do I send my child to school, to daycare? Because we have a lot of young mothers here that works at the health center. And for us, some of us know that daycare prices, it's sky high. And if you have to choose, we have a lot of vulnerable patients here also, and that uses the health center. And so what are the choices where people are going to die? And whether we want to believe it or not, it's going to happen, because people are going to make choices. And what are they going to say? I need food on the table. I need to keep the lights on. I need to pay the bills. So I need to have heat. And then healthcare, in my mind, is going to be the last thing that they're going to be thinking about, while there are going to be a lot of chronic disease. And then when they try to receive their healthcare, it would be too late. So people are going to die one way or the other.
Cari, is that also what you've been watching on the statewide level here, those sorts of trade-offs?
Yeah, I think what Anestine is saying is correct, but I can speak sort of to the Steward Healthcare crumble or
That would be great.
demise. When they did a lot of things wrong, but the one thing that they did get right was the health insurance coverage for our workers and there being access. With the closure of that system, as you know, other hospitals were purchased by Boston Medical Center or Lawrence General, et cetera. We found that the coverage that folks were able to get through Steward was good because they used their own network. And so now that's lost. And so we're seeing now that these new facilities that have purchased the hospitals, the premiums and the plans or the plan designs are very expensive. And we have to fight back and push back on that. We need to partner with the current employers and say this is not sustainable. Workers were accustomed to having good coverage, quality coverage, so that they can stay well and be able to then care for the patients. So there's a huge struggle, and we're seeing the costs of premiums rising. And in fact, we are currently bargaining over 8,000 with 8,000 workers in Massachusetts, where it's coming to the table. We have to negotiate the health insurance. It's open enrollment is around the corner. And we need to figure out how we're going to fix that. We have PCAs going into contract negotiations next year. We have like 45,000 members, current members there. And then we have our nurses who are going to be going into bargaining negotiations next year as well. So it's a really serious challenge. And one that we're not taking lightly, but we think that partnering with the employers and trying to figure out a way to fight back these cuts and somehow, address that.
So how much of this was already looming before the Steward crisis? Because for many people, the Steward bankruptcy and its impacts were sort of a shock to the system, where you suddenly saw all of these community hospitals at risk. But help illustrate for me how many of these issues were in place or threatened before the actual bankruptcy.
I would just say staffing has always been an issue, always. Wages are always at the forefront. And, I guess going back to the staffing, it's a huge problem because the patients rely on being able to seek care. And if there's not the staff to be able to care for them, they either wait or they delay care or they don't seek it at all. And then it causes larger problems in the end. People end up in the emergency room that's already overwhelmed. And it's just a financial burden, a moral burden. And people will continue to feel the pressure.
I think I'd like us to close out with, starting with Anestine, what are your main asks here? What would help ease the pressure on the workforce? You mentioned having the capacity to hire more union workers as opposed to relying on shorter term employees who are sort of filling the gaps. But what else from your day-to-day perspective is feeling like a pressure that you'd like to see relieved?
I with the always is more staffing, as we just spoke on that. Always to make sure that which we do have adequate supplies. As we said, we are not mandated to do overtime. We pick overtime if we really want to. I just feel that with the Medicare cuts that's coming down, I am nervous about that because our patients are not coming in as they are afraid. What the impact that would have on us as union members follow would be, because if we cannot have enough, we're not going to get the reimbursement for our providers and Medicare. Lots of our members here use Medicaid for themselves and their children, even though we have private insurance. I have the insurance that we offered here, but a lot of our members use Medicaid and Medicaid for themselves and their families because they cannot afford the insurance. I'm also worried about with the reimbursement. So I'm worried about follow. I'm worried about our facility closed. Right now, we are okay here at the health center because I think we are in a good spot here with this is Congressman Lynch, Senator Collins, Beal, and all the folks that lives in South Boston here. But there comes a time, that's them. We're looking forward to see what our patient needs are. As union members, I'm not just worried about this health center. I'll be amiss if I said so. I worry about all my sister and brothers' health centers, hospital, home care workers. What affect an injury to one is an injury to all. So what happens here or what happens there can happen here.
And I think that kicks off the last question for you, Cari, which is what closures are you worried about? Are you watching for additional contraction? Of course, we've seen a really long run over the decades of consolidations in different health centers, but what are you watching in terms of system contraction?
I would say in behavioral health, we continue to see a bunch of closures. We see new ones that are potentially at risk. I'd say everything. We are concerned about every area: hospitals, nursing homes, and home care. It's all a struggle. It's going to continue to be a struggle. And for me, I feel Massachusetts has always led in the way of healthcare, and we don't back down, and we shouldn't, because we believe that, you know, no matter what someone's income or zip code, everyone deserves access to quality care. So our ask is, you know, to ensure that we're funded appropriately so that we can protect these services and reduction of services, and not to see any more closures. So we want, you know, our members, our leaders to talk to each other, our neighbors to talk to each other, and local leaders to hear our plea that we have a lot to fight for and it's worth fighting.
Cari, Anestine, thank you so much for taking the time.
You too as well. Thank you.
Thank you, everyone. Have a nice day.
Have a great one.
You too.
Thanks again to Cari Medina and Anestine Bentick for joining me today on the Codcast. Thank you so much for listening. I'm Jennifer Smith. Our producer is Charlie Cazella. Our theme music is also by Charlie Cazella. Leave a rating and review wherever you're hearing this now if you want to help other people find us, and email codcast@commonwealthbeacon.org if you ever want to get in touch directly. We'll be back in your ears next week.